that lady was dragging him in. Again, it's unsterile. You don't touch things. Hey everybody, Dr. Bob, your ENT surgeon based in India, and today let's react to all the medical scenes by the legend Mr. Bean. So today we'll be breaking down all the chaos and comedy acted by this man in the movies along the way.
Dr. Jacobson?
Yes.
We need you urgently in OR3.
No, can do. I'm doing number 4 at 1.
Sir, it's urgent. We have a ruptured kidney and massive bleeding.
Okay.
Yeah, pretty much that's like the life of a surgeon or an emergency physician. Be running around, no time for yourself, busy with things to go around and get things done with. So that's more like the hardships that you see every day, that I pretty much see every day. Everyone is going through it, and unfortunately this is what it is.
Hello, doctor. We've got a 45-year-old male, type B negative, brought in by paramedics 10 minutes ago.
He's got a penetrating injury to the left chest.
Yes. Gotta get him in there right now.
Oh my god, no. That is totally not the way how in real life scene it happens. You can't actually walk into an OT and directly push you into a case and tell this thing so and so, this is so and so, you have to do it something. We can't do magic. Even if it's an emergency case, whoever's on duty at that moment of time, midnight, whatever, they will see the case, examine, do the investigations, then prep for OT, then take the emergency OT. And this is also not the way of accurately doing scrubbing for an OT, because you have to do this systematic hand wash techniques for like a couple of minutes, do the hand wash, then wear the gown, sterile gown, the gloves, head cap, mask, everything. So it all should happen by themselves, not that someone puts it up for you.
Doctor, it looks like a bullet in the lower thorax.
You don't enter OT like that. It's just like that lady was dragging him in. Again, it's unsterile. You don't touch things. Plus, when you walk, you don't walk like that random way. There's this proper technique of raising your hands up, either like this or like this. So you do that and you enter, making sure you're not touch anywhere, because you want the full procedure to be sterile.
Watch he doesn't go into hemodynamic shock. We'll be right back.
Okay, so what is this hemodynamic shock? So basically, under the category of shock, there are multiple other categories, one among them being hemodynamic shock. So what happens is that in hemodynamic shock, where the heart, which is supposed to circulate blood to all parts of the body, fails to do that. So because of that, there will be decreased perfusion of blood, there's decreased oxygen that's reaching all the parts of the body. Then later, that organ starts losing its function, it can get damaged, and even death can happen. And another thing I've noticed is that even though whatever emergency happens in the other OT, you cannot abandon the current one, skip everything and everyone can run out to the other one. You don't do that, because then meanwhile in the bargain you might lose even the current one. So if that's the case, only the head surgeon, like the most senior person, one person might just leave the OT and see the other place, stabilize it and come back. Not like every single one, like how they portrayed here, run away. They can't do that, and they shouldn't do that. At least someone sensible, some senior, someone should be there monitoring. But at least not Mr. Bean should be there, right? Hey, you're not supposed to touch anything. That's unsterile. Like you did all the hand wash and all asepsis you try to do. You come inside and you touch random things, then all the sterility is gone. Basically, you have to again remove your gloves, go back, wash again, come back and put the gloves again. So again, it should be all sterile precautions. Nothing of this is actually acceptable. Array. Oh my god. That's like fully unsterile. First of all, he's touching everywhere. That's first of all gone. Second of all, he took something. He took a chocolate and that went inside that man's body. Again, infection. We will just have to step up the antibiotics, and the whole surgery is just gone tossed, because you just randomly inserted a foreign body which is totally infectious. And one more thing I noticed is that the endotracheal tube, the tube which that patient who was lying down had a tube, right? That's through which these anesthetists or anesthesiologists they monitor the breathing and the ventilation of the patient. So this tube just cannot be kept like that. You have to keep it. First of all, it goes beyond the larynx, the voice box, just before the lungs. So to make sure that the air is directly going and ventilating the lungs. And the main thing what is required here is making sure the tube is secure. What we do is that we keep a tape around the tube and stick it around the face so that the tube is in place. It won't come out. Or some keeps even a gauze piece tied around to the tube so it stays in place, because we don't want the tube to come out. Once the tube is pulled out intra-op, I mean between the surgery, if something happens to the tube, then it's again further complication. We might even lose the patient on table. So to prevent that risk, we have to keep the tube secure. So if you're watching till here and if any of the scenes gave you anxiety and laughter at the same time by the man, the Mr. Bean, you know what to do. Don't forget to leave a like and subscribe for more. Oh.
Doctor, you can't just... It's too dangerous.
He's not even looking.
Incredible.
Heart rate is stabilizing. Blood pressure's climbing back.
Look at his face of overconfidence. I mean, he's achieved something extraordinary. Yeah, I mean, yeah, give it up for that. So removal of the foreign body and sequence and the sequelae, what happens after that is something we should take care of. The next thing you should be concerned about is if there's a bleeding that associated with it. After you remove the bullet, if there's a bleeding, we should make sure we stop the bleeding. We cauterize, bipolar, or use any sorts of ligation, whatever required, but you have to stop the bleeding. So though this scene looks all dramatic and beautiful, I like it, but in real life, again, I'm saying it is not the removal of the foreign body that's important. After removal, the managing the patient, making complete hemostasis is achieved. That's what we want, meaning bloodless. Oh my god, he just flew. But the thing what he's used here is called a defibrillator, which basically sends electric shock to reset the abnormal heart rates that's there. Here we give around 120 to 200 joules of energy that's used for an adult. So other thing what I've noticed is that it's not that you directly plug in and it charges up and then you touch and it delivers the current. It's not like that. You connect it, the machine turns on, then you have to set to how much power you want to set it at for. After that, you press usually there'll be a red button or something which you press. Following that, it charges till the amount of power you want. Following that, the paddles what we use, right? That's what you keep, and then you press one more time and that's when it delivers the shock. It's not that you touch and it acts. And obviously, if someone flies off like this with a touch of defibrillator, then that's it. That's patient's just gonna lose his life for sure. He just ran away from his life. Oh, that's so sad. Well, it looks like probably like a cardiac arrest, like he was holding on his chest or acute chest pain. And to be honest, there's many that such incidents are happening. You don't have to be old with other multiple illnesses. Even young people are getting this acute coronary syndromes, sudden cardiac arrests and losing their lives. So this is where you start your CPR. Nope. That's all inadequate chest compressions. This is where you require an actual training for CPR, or at least have the knowledge about basics of what to do. Well, for adults, we have to give at least 2 to 2.5 inches of compression. It should not be too shallow. It should not be too powerful also, because it can injure and it can break the ribs also. And the rate at which what we give is around 100 to 120 per minute. You can think about the song Staying Alive, by the way, which I've done a reaction for the Office medical scenes, which I will link it up here. Do check it out. It's really funny. And we should make sure our arms are locked in. We give compressions. proper compressions, and also there should be adequate recoil for the circulation to happen, and it should be simple, steady 30:2 ratio of 30 compressions followed by 2 breaths of like a second breath we have to give, and that's all that's required for giving adequate chest compressions. Oh boy, you should not give anything orally to the patient. I mean, he or she, it can just aspirate, it can go to his lungs, and that can directly worsen the situation. So all you have to be concerned about is just give CPR, nothing else, nothing extra, period. Oh boy, I really wish no one enacts this and imitates this stuff. It's all comedy. Please don't do any of this stuff. Well, if you're in an outside place or in a mall, somewhere, public areas, you get something called as AED, which is called as an automatic external defibrillator. That eases up the whole process of getting things done, where you bring the machine, open it up, you have the paddles which you can stick to the body. So you remove the shirt, keep one paddle to the right chest, other one to the left side of the chest, and you switch on the machine. It will detect the heart rate of the patient and it will tell you what to do. So once it's analyzed, it will tell you to start chest compressions, and in between, if it's a shockable rhythm, it will itself says to stop chest compressions, all clear, and it will give shock. And again, it will tell you to resume the chest compressions, and it will do and assist your way of doing a CPR. So you can make sure the patient at least comes out healthy. And by the way, did you see the new movie out by Rowan Atkinson? I mean, Mr. Bean, obviously. The movie called The Man vs. Baby, which is out on Netflix, and do check it out. Do let me know what you think about the movie, and obviously it's just fun to see him on screen, bringing back those Mr. Bean moments of our childhood. So obviously legend who has done a great job in his work. So yep, that's all for today, my friends. I hope you guys liked today's episode of reacting to all the medical scenes by Mr. Bean, and do let me know in the comment section down below what you guys want me to react to next. And as always, you guys take care, stay safe. This is Dr. Bob signing out.